Welcome to exercise considerations for prenatal and postpartum participants. My name is Dr. Shannon Lynch, and I'll be presenting the content today. I'm a national presenter for various organizations. I've authored numerous group fitness instructor training programs. Let's get started. The purpose of this course is to give you advice and recommendations on working with women who are pregnant or who were recently pregnant, so postpartum. Upon completion of this course, you should be able to discuss the benefits of exercise during pregnancy for the mother, describe exercise-related contraindications during and after pregnancy, including the warning signs that signify that the participant should stop exercising. You should be able to apply strategies for modifying exercises in a group fitness class, examine postpartum exercise considerations. Before we begin, it is important to understand that you should always exercise caution when providing participants with health-related information, and that group fitness instructors should refer their participants to healthcare providers for anything that is beyond the scope and practice of a group fitness instructor. Pregnancy is a time of rapid change, and many women think about the weight gain. Gaining weight during pregnancy should happen. Women who are normal weight will gain between 25 and 35 pounds. If they're underweight, between 35 to 40, they're overweight 25 pounds, and if they're morbidly obese, 15 pounds or less. Ideally, most of the weight should be attributed to the fetus and extra fluid. As pregnant women gain weight, she may not be able to move as quickly or be as agile. In addition, the growing belly may affect the range of motion and mobility. So there's some things to think about when working with women who are pregnant or at least moving towards the second and third trimester. Musculoskeletal changes happen to support the growing fetus and the upcoming demands of labor. Back pain is an issue for many women because the weight and position of the belly can cause lordosis or overarching or an anterior tilt of the pelvis, placing pressure on the lower back. Further, these joints become more lax due to an increase in the hormone relaxin. Relaxin helps the ligaments and soft tissue in preparation for delivery, but it can also increase a woman's risk of musculoskeletal injury because the integrity of the joints are not as resilient as they were pre-pregnancy. In addition, the growing belly changes the woman's center of gravity, which can have implications on her walking gait, coordination, balance during exercise, and possibly further increase her risk for injury during exercise. Moderate edema is normal and necessary during pregnancy. That's the fluid retention underneath of the skin. Edema occurs when capillaries or the lymphatic system link through it in between the spaces between the tissue. However, excessive edema is a sign the women may need to see a doctor as soon as possible, especially if they can barely fit into their shoes or if they really can't get their rings off. Edema can also cause discomfort and cause changes in the range of motion and flexibility during exercise. So that's something to keep in mind is, if they're really impinged in their movement, if their joints are so swollen, or if they're just not as comfortable moving, this may be an indication they need to see their doctor as well. Diastasis recti, that is the brown line that some women get that goes right down the middle of the abdomen or down the linea alba through the rectus abdominis, and is characterized by a vertical dark brown. Sometimes it's a little lighter, depends on the tone of their natural skin. It is caused by an intra-abdominal pressure from the pregnancy, also the weight of the belly pulling down. So it starts to separate the musculature in the connective tissue down the middle of the tummy. Not all women experience this, but those that do know that it's not a serious condition and it often goes away after pregnancy or after birth. At least the line goes away. In terms of the mother's cardiovascular system, pregnancy causes an increase in overall blood volume. Resting heart rate increases during pregnancy as well as the cardiac output. And if you recall, the cardiac output is the amount of blood pumped by the heart per minute. In addition, blood that is circulating through the body, such as the arms and legs, encounter a lot more resistance in this condition. This can be caused by narrowing of the blood vessels or increased blood viscosity. Because this can affect the overall blood pressure, pregnant women have to be mindful about their body position and remember not to lie on their back for too long or in any one position for a long period of time. When there are cardiovascular changes, there are usually concomitant respiratory changes, and that's certainly the case during pregnancy. During pregnancy, minute ventilation, or the amount of air you breathe in and out in 1 minute, can increase up to 50% due to increased tidal volume, which is the amount of air you normally breathe in and out per breath. These factors combined with the cardiovascular changes can make exercise very strenuous or make it feel more strenuous and challenging compared to pre-pregnancy performance. Therefore, pregnant women should resist the urge to overpush or perform at their pre-pregnancy intensity. It's very common, they want to continue to exercise at the same intensity they did before pregnancy, but they need to be mindful of some of these changes. And no matter how fit you are or how fit you were before pregnancy, everybody has to be mindful during pregnancy during these changes. Heat stress from the environment or exercise can also be harmful, specifically to the growing fetus. Exercising in a cool environment with adequate hydration and overall common sense to stop exercising if it feels bad or if the woman feels overheated are very manageable ways to help keep the fetus safe during exercise. If a woman is accustomed to working out in a hot environment in pre-pregnancy, let's say it's in a hot cycling class or hot yoga or Pilates class, don't always assume that you can continue to do that through your pregnancy. And that's certainly something that a woman should bring up to their doctor, especially if that's an activity that they did before pregnancy. So that's a conversation they really need to have with their doctor so the doctor can give them better advice on how to proceed forward with that if that's something that they really want to do throughout the pregnancy. Lastly, due to hormonal changes, glucose metabolism changes during pregnancy, and the fetal demands for glucose affect glucose homeostasis further for the woman. Women with pre-existing type 1 or 2 diabetes mellitus or gestational diabetes really need to be counseled by their doctor about managing their glucose throughout their pregnancy, especially during exercise. This is certainly a case when women should obtain a physician's clearance before starting or resuming an exercise program. So glucose metabolism and homeostasis during pregnancy is very important to be aware of and understand how to manage during pregnancy. During exercise, pregnant women need to listen to their bodies and drink water when they're thirsty. They need to stop if they feel faint or dizzy. And of course, do not exercise in a fasted or on an empty stomach. Some women before pregnancy, they like to exercise in a fasted state in the mornings. They may not be able to do this as safely anymore once they become pregnant. So it's something that they need to be aware of. And as a group fitness instructor, this is something within your scope to provide them a recommendation on. Exercise during pregnancy is meant to improve overall health parameters such as glucose regulation. It boosts energy levels, it manages weight gain, it improves a woman's mood, it can help reduce water retention. Women who exercise during pregnancy have been shown to have a reduced risk for gestational diabetes, C-sections, or other operative vaginal deliveries. Exercise is also shown to improve physical endurance during labor. It helps reduce fetal stress during delivery and reduces postpartum recovery time as well in some circumstances. While exercise helps manage high blood pressure, prescribing exercise as a treatment for preeclampsia, or also called pregnancy-related hypertension, is not a current indication that doctors typically go for. Nor should a group fitness instructor who learns that they have a pregnant participant with hypertension, this is not something that you should be suggesting to them, is using exercise as medicine for that. They really need to have a conversation with their doctor if that is the case. And if they do start talking to you about it, again, refer them to their healthcare provider. Pregnant women, pregnant participants should stop exercising if. So these are some of the signs and symptoms that if you have a pregnant participant and they experience some of these signs or symptoms during your class, you should urge them or you should tell them or press them to stop exercising. And of course, follow all of your emergency protocol procedures within your facility. One is vaginal bleeding. Any type of vaginal bleeding is an indication they should stop exercising because it could be a sign of negative or dangerous situations that could be coming. Painful contractions. Now, we all have aches and pains when we exercise, but if a woman is accustomed to exercising, if she was exercising before pregnancy, she should be able to ascertain the difference between aches and pains in the body and a painful contraction in the uterus. Any amniotic fluid or heavy leakages. So if it's not blood but other fluids leaking, she should stop exercising. If she has any shortness of breath or dyspnea with exertion or even before exertion. dizziness or incessant blurred vision, headache, especially uncharacterized headache, or migraine intensity, chest pain related to signs and symptoms of perhaps a cardiac event that could be happening. Muscle weakness affecting balance and coordination. So that's not necessarily muscle fatigue, but if the fatigue is so intense that it's starting to affect her motor control, that is an indication to stop exercising. Calf pain, we all know that as, sometimes exercise-induced cramps, but for a pregnant woman that could be a sign that she needs electrolyte or carbohydrate, or she is very tired, and that the calf pain is an indication of that. And if she starts to experience extreme edema while exercising, so if it gets worse during exercise, she should stop. Exercise considerations. Other general considerations pertain to exercise factors. Recall, peripheral blood pressure can be affected, so women should not remain in a static exercise position for any extended period of time. So they shouldn't lock out their knees or do anything that would restrict any blood flow. Moreover, after the first trimester, women should not lie in the prone position and not remain in the supine or on their back for more than just a few minutes. Lying supine for an extended period of time, what it does is it shunts the blood away from the belly and from the baby, and that's something that we certainly don't want to have. Again, avoid hot, humid environments. That means certainly exercise rooms, like I suggested. To alleviate back pain, exercises that strengthen the back and other postural muscles are recommended. Lastly, she wants to avoid repetitive high-impact exercises, avoid excessive flexion and extension. So any excessive range of motion is not good when you're pregnant, again, because the joints are more lax, but also because of the coordination and the balance. They may not always be able to catch a fall, or they may not be able to reflex as quickly. They should choose activities in a safe environment, such as a gym, and this is opposed to running out on a trail or road cycling. They always want to be where they can seek help if they need to. Other exercise considerations for women, or exercise recommendations rather. Some of these, for example, they should exercise at least 30 minutes per day of moderate intensity exercise. Using the rating of perceived exertion scale or the talk test to monitor exercise intensity is now recommended. If they are used to using a heart rate monitor, if they are familiar with their heart rate and how it behaves under exercise, specifically while they're pregnant, that certainly is, they can still continue to do that. That is not contraindicated. But if they do not, they should really learn how to use their RPE to gauge their intensity. They should reduce their intensity and duration and frequency as they progress through their pregnancy if it is not well tolerated. And using an extended warm-up and cool-down will help them gradually move into activity and be prepared for some of the movements to come. Remember, warm-ups are meant to get the body ready for exercise. It's meant to raise the body temperature, and it's meant to prepare your nervous system for movement. So all of those things are very important to a pregnant woman. Again, select low-risk activities in a controlled environment. Outdoor boot camps, that may still be a controlled environment, especially since it's under supervision and there's people around. But again, outdoor skiing, or road cycling is not a safe activity for women that are pregnant. Remain hydrated, so not only drink water, but have an electrolyte replacement or something that might have fast-acting sugar, like a sports drink. Is okay as well. They should not exercise on an empty stomach, and we went through that a couple slides ago when we were talking about glucose homeostasis. And on average, eating for two during pregnancy is a little bit of a wives' tale. It's, she really only needs about 300 extra calories per day for the average normal weight pregnant person. Sometimes they may be on a higher calorie diet, but that's usually physician indicated. For the group fitness instructor, strategies for adapting to exercises, or adapting exercises rather. Pregnant women will have difficulty during certain things. So you, as the group fitness instructor, you We'll learn over time to come up with alternative options. Some of these alternative options are modifications or regressions that you would provide to an active older adult or someone that is beginning exercise or maybe rehabilitating from an injury. So keep in mind, some of these things are not just indicated for pregnant women, but you can use them for the general population as well. Pregnant women will have difficulty performing high-intensity exercise. So what that means is instead of sprints up a hill during cycling class, cue them to maybe briskly walk up a hill during cycling, or imagine that she's climbing steps to maybe control that intensity during indoor cycling. If it's a cardio dance class, she can omit some of the arm movements that elevate the heart rate if she feels that her heart rate is spiking. If it's an outdoor boot camp, if there's hurdles set up, maybe she can march over the hurdles as opposed to jumping. Instead of throwing medicine ball chest passes, throw medicine balls overhead. And if there's a lot of running in your class, plan to provide a stationary area that maybe she can do step-ups, or maybe provide her an area she can perform the exercises but maybe at a shorter distance or for a shorter period of time. She will not be as agile or very quick, so keep that in mind. Squatting can also be very uncomfortable. As pregnancy progresses, because of the intra-abdominal pressure and the pressure on the pelvis and the pelvic bones, in addition to placing some small plates or towels under her heels, which when you bolster the heels, by the way, that helps reduce the amount of flexion someone needs to execute for the squat. So it makes the weight shift a lot easier. So in addition to that, for squats, you can modify that by doing squats on a wall, or place a stability ball behind the back while she's squatting, which is a more comfortable version because it helps support the back and it helps unload the back as well. Seeing her feet will become more of an issue as she advances into the third trimester. This can increase her risk for falls, so suggest that she maybe place her equipment to the left or the right side so she knows where it is at all times. And during class that requires footwork, such as a dance class or a step aerobics kickboxing class, a lot of movement, she should always have a visible spot in front of the mirror. She should have a safe area that she can do movement slower, so being right in the middle of the pack may not be the best place. And for classes such as step aerobics, if she's used to using 2 step risers, maybe go down to 1 or even just put the platform on the floor. That'll help reduce her risk for falling. Bringing objects like barbells in front of the body, exercises like cleans or upright rows, or even lowering the bar from an overhead movement could be awkward and consequently perturb her balance or compromise her form. If you notice this and it's a visible issue, demonstrate how to modify with dumbbells. For example, instead of a clean, how about break it down and do a squat into an overhead press in a compound movement, so it doesn't have to be an explosive movement in front of the body. Getting up off the floor, and again, this is not just an issue for pregnant women, it affects other people in your class, such as active older adults. So from off the floor, show participants how to roll over onto one side, how to push off the floor with their hands into an all-fours position, and then from the knees to a standing position. They should be near a wall or a ballet bar or have a chair if that helps as well. And, I've had some times where I've had to maybe provide participants a 30 seconds head up. Hey, we're going to be moving to the next exercise in 30 seconds. You can continue to finish out your last 30 seconds, or it's your choice. You can start transitioning to the next exercise, which is blank. So providing them a little bit more time to move to the next exercise is an option as well. For pregnant women, getting up even from the seated position, such as if they're sitting on their step riser platform, it might be difficult for them to get up from that position as well. So if you notice this and it's a problem for some participants, provide a standing option if you know the transition is going to be fast. For example, for tricep dips, if you're going to go right into something very quickly, maybe suggest that she does tricep kickbacks or doing an overhead tricep extension, so that if the next exercise is quickly transitioned to a standing exercise, she's already there. Forward flexion, so doing a sit and reach or even just touching the toes, will be tough as her belly grows. So instead of doing a sit and reach, she can sit down into a V position and maybe do a gentle lateral reach to stretch the side body. And if she wants to target the hamstrings, Suggest that she sit on a bolster or even on a step riser or a step platform on the floor so that she can lift up her hips, which helps reduce the amount of flexion to do the stretch. Couple more. Obviously, running and jumping is going to be dangerous due to the factors mentioned earlier, not as coordinated, lax joints. If you teach a HIIT class or if you teach a high-intensity class or a circuit class, get into the habit, and if you can, and if you can't really, maybe push your facility operator for allowing you to do this, but get into the habit of rolling in a stationary bike, a rower, so that, not just the pregnant people, but people that maybe have injuries that they can't run. This will help them have, a viable option or a sizable solution so that they can participate in the cardio. If you run a small group class that's on the gym floor, or consider using the elliptical machine for a lower impact activity. If you're on a basketball court or an outdoor court, use painter's tape or chalk to make a makeshift agility ladder. Or draw circles so that she doesn't have to worry about tripping over ladders, hurdles, or cones. And that's a great option for kids too. Mountain climbers, a modified version can be hands on the wall and just lifting the knees towards the chest. With that said, burpees are also common, and there are a lot of ways to modify a burpee. But the simplest version is to start with their feet in a wide stance. They squat down low enough just so they can get their hands placed on the floor. They'll step back 1 foot at a time into the plank position. They can omit the push-up. They'll step 1 foot back in at a time, but they'll step in into a wide stance so that they can stand up in a wide squat and then omit the jump. So that way they can still participate in that exercise. Lunges, doing a forward lunge, oftentimes, and you know this, that people tend to lose their balance in a forward lunge. So a reverse lunge, especially if they have a mirror and they can see where they're placing their foot, is a good option. If that is not a sizable solution, doing step-ups is a version, especially if they keep 1 foot on the step or the bench at one time in between reps and then switch sides. Split squats, so that's a stationary lunge. Again, balance issues, so they can just take their feet out a little wider in a split squat, like as if they're split squatting across train track.